So, good morning, good afternoon, good evening, based on where you're joining us from, and welcome to today's webinar. My name is Laura Chechi Galanos. I am the Executive Manager of the World Stroke Academy, the educational platform of the World Stroke Organization, that provides stroke education to health professionals worldwide. Now, it's with great pleasure that we are hosting this WSO educational activity today, a guide to neurointerventional training under the International WSO NIR Fellowship, with great speakers who will be sharing their expertise on the topic. As per usual, I am sharing with you our housekeeping rules. We welcome any questions you might have throughout the webinar, but we kindly ask you to use the Q&A box for those and not the chat, so that our speakers can address them at the end of the webinar in the Q&A discussion. So questions in the Q&A box. You can, of course, use the chat box to say hi, tell us where you're joining us from, or leave any other comments. And also a reminder that this webinar is recorded, and the recording link will be sent out to all of you via email shortly after the webinar, and it will also be uploaded on the World Stroke Academy. Now, without further ado, I will give the floor to Dr. Violiza Inoa, board-certified neurologist specializing in vascular neurology and neurointervention at Semmes Murphey Clinic, and assistant professor for the neurosurgical residency program at the University of Tennessee Health Science Center. Violiza, the floor is all yours.
Thank you, Laura. Let me share my screen. Can you see me and hear me well? Perfect. And can you see my screen? Perfect. Okay. Well, good morning, everyone. It is a true pleasure to be here with you today. As you can imagine, talking about an international fellowship for neurointervention could take a while, and we have been working on this for some time, and I am beyond grateful that I'm actually able to talk to you about the fellowship this morning and to welcome you to this webinar where we will be discussing the details for some of you to be part of the fellowship, to apply, to be trained in neurointervention in another country, and to many of you who actually will harbor our fellows. So again, I thank you, all of you, for being here today, for your support and your patience. So first of all, I would like to introduce some of my best friends and colleagues that have been extremely helpful and supportive throughout the process. And without these people, I'm pretty sure we would not be here today. So Dr. Gillian Gordon Perue, she's a vascular neurologist at the University of Miami. And she will be talking to us about some of the structure of the fellowship and the application process. Dr. Rina Ten, who is at Jefferson University from the Dominican Republic. By the way, I'm Dominican and Gillian is from Jamaica. So Caribbean ladies. So she will be talking to us about the educational platform and the vision that we have for the fellowship. Dr. Nitin Goyal, he is a neurocritical care doctor and neuroendovascular doctor here at Semmes Murphey Clinic. He'll try to join us towards the end of the webinar. He had a conflict at work. And I also have here Dr. Shayla Martins, who's our executive officer for the fellowship. But actually, I mean, what that means is that she's our boss. And the reason why we're here, and she took this idea to another level. We came to her with this idea, and of course she said, "Oh yeah, that sounds fantastic. Let's do it. Let's do it tomorrow." So without Shayla, we would not be presenting this idea, this project today. And this is one of the so many things that you are doing to advance stroke care and to help patients around the world. So again, thank you so much for being here. And if you don't mind, since you're here, if you would like to say a few words, please.
Thank you, Violiza. Thank you for your kind words and welcome to everyone. It's a great pleasure for us to really launch this fellowship program that we are planning Violiza idea, but as always, yes, let's do it. And I'm sure that with this amazing team, will be a fantastic program. I'm sure that we can help a lot of people, and it's a great pleasure for me to be here today, Violiza. Thank you very much, and thank you, Gillian, Rina, and Nitin for this amazing work. Thank you, everybody that is joining this program. The amazing neurointerventionalists join as part of the executive committee and training center. So thank you so much. And also, of course, for the applicants for the program, we are very proud, and we have a great pleasure to open today to launch this program. Thank you so much.
Thank you, and the honor is ours. Okay, so a brief overview of what we are going to be talking about today. Of course, we would like to introduce the fellowship, but we would also want you to get a good sense of the structure of the fellowship, why we're doing it, what is the vision, where we are planning to send the fellows, who are going to be the applicants, and who will be able to train under the International Neurointerventional Fellowship for WSO. Something that is very particular about this fellowship is that we're not only looking for applicants, but also for institutions. So in a way, this is going to create a map. And the plan is that we're going to be able to expand to institutions that will have the capacity and already have the capacity to train people that are not currently doing so for some reasons. So maybe they don't have the fellows. Some institutions actually are having some issues trying to get people from other places, etc. So the hope is to facilitate and open these channels that currently do not exist and expand the channels that already exist. Another nice feature about the fellowship is that we're going to use the fellowship as an educational platform for neurointervention where we are going to build an online platform through the World Stroke Academy. We will be able to incorporate lectures every month for the fellows, but also this is going to be open to anyone that would like to learn from neurointervention. So again, it's another opportunity out there that doesn't currently exist that we want to expand, especially for low and middle income countries. And the reason why we thought about this fellowship, I don't have to explain much, right? We know that the disease we want to tackle, neuroendovascular diseases, are extremely prevalent and are killing millions of people and are one of the main causes of disability around the world. But the problem is very disproportionate. It really affects more our countries, countries under development, countries that do not have the adequate access to treatment. And we don't have a lot of data in terms of the access to neurointervention. We do have a nice paper published by Dr. Asif a while back, and it is the empty glass that talks about the access for thrombectomy around the world, but indirectly it also talks about the number of neurointerventionists around the world. And unfortunately, the numbers in countries that are, again, in development, low and middle income countries, are fairly low. The access is fairly low, and it truly affects many of these countries, creating this loop, right? So where patients are sicker, patients are not being able to get treatment. And do not take me wrong, I live in the United States, and I know the state is not perfect, even in developed countries. However, because of the mission of the World Stroke Organization and our particular goal and mission, we have decided that we really want to invest some of these thoughts and time in trying to help some of these countries, especially, some of these countries where we're coming from. So I don't want to offend anyone, but I hope you do understand. Part of the mission of the World Stroke Organization if you wonder, is also to tackle advanced interventions. When we think about global WSO, we're thinking about global care. We're thinking about stroke at every different level, all the way from minimal, essential to advanced. So thrombolytics and advanced mechanical thrombectomy has been part of our mission. And under the leadership of Dr. Sheila Martins, who created the implementation task force, we have developed programs to advance neurointervention, specifically mechanical thrombectomy. So we developed the mechanical thrombectomy training pathway program that started in Latin America about a couple of years ago now, where we have been able to go to Colombia, Mexico, Argentina, and many others. I hope I'm not missing any of these countries, but we have been able to put foot on the ground in trying to understand what's a reality in some of these countries. And it was fairly obvious that there was a huge need for neurointervention training, and this is how this came to fruition. Some of you I've met through some of the workshops that we have been doing over the past few years. Some of the pictures here, we were truly inspired by the development of these workshops, but also by going to these countries. These are pictures from the workshops that we did in Jamaica and Dominican Republic, and we were able to understand the importance of education. And we know that education is extremely important in terms of advancing care, especially when we're talking about, the skills that are required to treat these patients, the skills that are required to do a thrombectomy and other advanced neuroendovascular procedures. But I think this was an eye-opener in the sense that we were able to test and demonstrate that actually hands-on and training and interaction with people that have the experience will enhance knowledge and will enhance skills. So this is why I wanted to present this today, because again, this was one of the main inspirations for us to think about a formal neurointerventional fellowship. And the purpose is to increase neuroendovascular capacity in low and middle income countries. And I think I explained a little bit of why we decided to do this in low and middle income countries, because as you know, the services are lacking, and we definitely need more physicians that will be able to practice neurointervention to the highest standards. And it's, again, important that we understand that the fellowship is made for people that are connected with their countries and are coming back to their countries after they undergo the training. Once again, I wanted to present some of us that are going to be part of the fellowship leadership, but this is also an overview of the fellowship leadership structure. I serve as the chair and program director. Gillian Gordon Perue and Dr. Rina Ten are the coordinating co-chairs. Dr. Goyle is the education chair, and Dr. Sheila Martins, our boss, is the executive officer. But this is not only the work of the faces that you're seeing here. I want to, with a lot of gratitude, mention that we have invited to this fellowship leadership 25 specialists that are well recognized around the world because of their work in neurointervention, stroke, advancements of education. And they have experience in training people, experience in knowing what it is required for people to do this type of work, and also to travel and train and train in other countries. So that is the Neuroendovascular Board for the fellowship. And I will describe a little bit of what that means and why we believe the fellowship is crucial in making sure the standards of this Neuroendovascular Fellowship are high. So the board, along with the fellowship leadership, will look at the applications, at the applicants for institutions and for the candidates that are interested in the fellowship, and will decide if the people and also the institutions meet the requirement. And we will have internal meetings for these decisions. The applicants will be selected, the institutions will be selected, and then we will create a match. The applicants should be trained for 2 years total. So if you are an applicant and you're already either practicing neurointervention or you're doing a fellowship for 1 year in your country, you could go to another country and train for another year, but the total duration of the training should be 2 years. And then those candidates are going to developed countries, high income countries, where they can train. And upon the completion of the fellowship, physicians are expected to return to their home countries and serve as a neurointerventional doctor. We will definitely prioritize people that already have connections with public institutions, because we really want to serve those institutions. And Dr. Gordon Perue will be able to tell you a little bit more about the details for the selection for the candidates. The fellowship board, as I said, is constituted by 25 physicians around the world. We try to make it diverse in terms of specialty and location. This is an international fellowship, so we really wanted international representation. The fellowship board will oversee the fellowship training. And I have to say that before we had permission to even have this meeting and explain the fellowship to you, we had board meetings and we presented this idea to this group of people, and we decided on the criteria, and this has been a very thoroughly discussed project. So I'm very glad for the time, and I am grateful for their support. The fellowship has been developed under certain standards, European standards. We use some of the standards from the US. I believe CAST was the body that created some of these criteria. So we try to merge some of these criteria in order to come up with a good, what we thought was a reasonable criteria for an international fellowship of this category. The board will serve as liaisons. So as you know, we have so many institutions around the world that could serve as potential training center. These people know so many people, and I could use any. Actually, I opened the invitation for so many of you that know about institutions, but also these people with you know the local reality of training and limitations. So we actually need to hear that feedback. These people will be serving for 2 years, and then, as long as they want to serve, so that we will continue to renovate their house, and we will continue to meet at least twice per year. The fellowship board will serve as educational faculty as well. So the board members will have the platform for education. So our fellows will have access to these people. So these are the names of the people that I've been talking about. I really want to thank each one of them for the support and also for the review of all of these criteria for the fellowship. I really want to give special thanks to Dr. Mark Rebo, because he has been crucial in finding institutions in Spain, especially from up to offer those fellowship positions to people from Latin America. And he has tremendous experience doing that. he has been doing that for so many years. So his feedback was extremely important for us to go through this process and ambition the fellowship. Again, a group of excellent individuals, and they will be your fellowship board. And hopefully, once we open the platform, you'll be able to see and recognize some of these faces. Important question: how is this fellowship sponsored? So the World Stroke Organization will be requesting some grants. So we will offer unrestricted educational grants, but that's going to be limited to availability every year. So for this upcoming year, we have 2 grants. However, government and sponsorship more than welcome, and individual hospitals, partners from industry, other organizations can support fellows if desired, and that's going to be detailed in the application process. So once you apply, you have to let us know whether or not you're applying for a WSO grant versus if you already have some level of sponsorship. Well, I would give the platform to Dr. Gillian Gordon Perue, who will be talking about the application process.
Thank you so much, Dr. Inoa. We'll switch. It's really an honor and a privilege to be here. I cannot say thank you enough to the World Stroke Organization for really getting behind us and being so supportive. And also, of course, special thank you to the World Stroke Academy for supporting us. I think I'm actually at the back of the slides. Hold on one second. Let me make sure that I'm in the right spot. So I wanted to go over with you because, of course, this is an exciting time, right? As Dr. Inoa said, really, we want to be able to offer this program to physicians across the world who would really like to be trained in neurointervention, and the process is not yet available. So I'm going to go over with you who is eligible, how to apply, what's the timeline, what are the expectations, what's the process that you'll be going through, what's the assessment, and how do we ensure that you're successful in completing this fellowship. So the best candidates are going to be those physicians who are currently living and working in a low to middle income country that's currently underserved for endovascular therapy. Really, our aim is to build capacity. We're trying to build the workforce to meet the task of this global disease that is really affecting low to middle income country. So physicians should be already trained, so they can be neurologists, neurosurgeons, or radiologists. All you have to do is submit to us your certification that says, I'm already trained in one of these specialties. You should hold a valid practicing license in your own country. Again, we're trying to find physicians who are currently working and practicing in that low to middle income country so that we can train you and you can go back home, because the aim is capacity building. We are, as you heard Dr. Inoa saying, going to pair you with a high income country and have you go to that high income country for training. And so if we're going to try to find that high income country, it should be a country that you're able to have licensing in that new country. So if you're in Uruguay, we would try to match you and pair you with, say, Spain, where the Spanish language is going to be similar between the two places, and you have the ability to get licensing there. We will have you work with us through this migratory paperwork process as well. The programs and facilities that we'll choose will help us get that part done. And then once you complete the 2-year fellowship program, you should be committed to returning to your home country. And there's going to be documentation to help us to say, yes, you're committed to going back to your home country. So how do you actually do this process? We're creating, with the help of the World Stroke Organization, a website landing page. This is what the landing page will look like. So once it goes live, I think it will go live shortly. We're just waiting on a few details. You'll go to WSO World Stroke Organization. You'll go to what we do, and then find the tab that says Education and Research. So what we do, then Education and Research, and then under the Education tab, you'll be able to find the International Neurointerventional Fellowship. This will be what the landing page looks like. This will be reminiscent of this webinar. Dr. Inoa just showed you this picture of this page. And so you'll know that you're in the right place. Additionally, if you're listening to this webinar, but you're not the person you have in mind for training someone else, this website will allow you to share the link for this application process to someone else who you think might need it. Once you get onto the portal, there will be a section that says Fellowship Candidate Application Process, and a separate section that says Facility Applications. So what's really nice and dynamic about this program is that we're looking for both fellows and facilities. So if you're listening to this webinar and you're in a high-income, high-volume country and you're willing to train fellows, we're happy to hear from you as well. There will be a special facility application process, and I'll go through that in a minute. If you're the fellow, it will ask you and walk you through the steps for application. For the fellows, there is a non-refundable application fee that we think is small, but it's just so that we are sure that we're getting applicants who are serious about the fellowship. So it's a small application fee of $20 that is non-refundable. There is no facility application fee. So once you go to the website, it will create this portal for you to go in and put in these details. We will ask you for a letter of commitment from your home country that says you're going to go back to your home country. We will ask you for proof of your license, all the things that I just went through. Now, as you heard from Dr. Inoa, the fellowship training is a minimum of 1 year, ideally 2 years of formal training. So if you are considering the 1 year track, in addition to your typical application, we'll have you submit case logs. So what happens when you submit all these details to us? Once you submit all your details to us, as of March, so in a few days, the website will be open and you can go in and submit the details. The committee, the board of advisors that Dr. Inoa spoke about will actually meet and review all the application process. They will also review the facilities that we have. And like Dr. Inoa says, try to make a match between the fellow and the facility. Once we've made that match, we then start the process of getting you credentialed in that facility that we identified for you. And then the expectation is that you'll hear by June of that year that you're accepted to start by September of the following year. So for this September, we're looking for the first cycle fellow to get started. The fellow will have hands-on training in their institution, in their international institution. They will also participate with the World Stroke Academy educational didactics that Dr. Then will tell you about in a few minutes. And that will start and kick off their educational training. In October of that same year, so in this year, October 2025, we'll open the portal again for a second cycle of application, this time looking for the person to start again in June. The committee, the board will review the assessments of the first fellow that's already in training and then review the applications for the new fellow. and so on and so forth in a continuous loop and a continuous cycle going forward. I should say that in order to apply and be a fellow, you should be a member of the World Stroke Organization. That's very important. Not only is it important for the application process, but it's also important because World Stroke Organization has a lot of resources for building stroke programs throughout the world. They have the roadmap that you saw Dr. Inoa show at the beginning of the talk. And there are a lot of other educational things going on simultaneous to the fellowship that's going to be helpful for you. So you'd be, so we encourage you to be WSO members as well. Once you're doing the actual program, how do we assess you? We're going to assess candidates based on the typical typical metrics. That is patient care, medical knowledge, system-based knowledge, practice-based learning, professionalism, and communication. Evaluations will be conducted at regular intervals with your preceptor. Excuse my cough. So evaluations will be conducted at regular intervals with your preceptor. The didactic session that Dr. Then will talk to you about, we expect that you'll be present in 80% of these didactics, and you'll track your care, your services with a case log, okay? So we're going to be assessing your competencies across these major areas. I wanted to show you what our evaluation is going to look like. So you will have basically a special form to use for patient care, medical knowledge, system-based practice, practice-based learning, and professionalism. So multiple layers of evaluation, and you can see sort of a stepwise growth in your training over time. And similarly, we will also have a case log for you to use to track the number of cases based on your training over time. And we will have special specifications about the number of cases that you complete as a primary versus as a secondary operator. So the goal of the fellowship in year 1 is to advance your knowledge of the endovascular anatomy of the brain, spinal cord, head, and neck, and increase your proficiency in vascular access. You should be an independent operator for diagnostic angiograms. And by the end of year 2, you should have completed at least 200 neurointerventional procedures and participated participated in 80% of the didactic curriculum that you'll hear about shortly. The 2 years should be continuous. We shouldn't separate them with time. So if you are a facility that's looking for participating in the fellowship, you'll have your own facility webpage. To apply, there will be a facility checklist that you'll go through, really just helping us understand if you have all the parts available to train our fellows. The facilities should have a program director and a program coordinator. The program director will be an appointed faculty for the fellow and will be in charge of the training for that fellow on the ground. Once you apply, the fellowship board or advisory board will actually review your application process to be sure that the training institution meets the requirement. If training institutions do not themselves meet the training requirement, they can partner with another facility. So for example, if we recommend that places do spinal angiograms and you're not having a lot of spinal cases, you can partner with another institution that is local to you, and together they can become one training site. So that is a possibility. So if you're listening to this webinar and you'd like to have Neurointerventional International Fellows at your institution, feel free to apply. It's going to be the same web portal, just a different section for the facilities to apply. And so with that, I'll hand over to Dr. Reina Finn to present on the educational platform.
Thank you very much, Dr. Gordon Perue. So I want to start thanking, Dr. Sheila Martins, our executive chair, Dr. Violiza Inoa for her leadership as well. I think without you both, we will not be here. I have to thank the other chairs too, Gillian, Gordon Perue, Nitin Goyal, especially Dr. Goyal, who's not present here, but he actually worked real hard on the slides I'm about to present. He's our educational chair. I just want to make sure, you all know that these people really work real hard to make this possible. So thank you for the opportunity. I'm going to share my screen. Just we'll need probably 1 second to do that. And, we're going to move on to the educational material, right? That we, I don't know if you can see my screen there. Can we see it?
Yes, we can.
Okay, perfect. So I just want to start saying, to be a neurointerventional fellow, we have to be able to provide an excellent training in neurointerventional procedures, but that comes with some education involved, right? So I just want to start saying that the lead and the core educational activity for the World Stroke Organization is actually the World Stroke Academy. So most of the materials that we're going to be sharing through the fellowship to train you well will be through the World Stroke Academy. So the way we envision this is actually providing Zoom, through the platform of Zoom, educational material that is live. So the fellows will have the opportunity to actually interact with highly curated speakers in various topics. And we're going to talk about what those topics will look like within the, the span of a year or two. And, also you're going to have the opportunity to watch those lectures at your own time, right? So in case you had some thoughts or doubts about a topic that was discussed in a month, you can always go back to them and, definitely reach out to the speaker as well to, fill out all those gaps in knowledge. I just want to say that this is an opportunity we all do have even as of today, although not part of this fellowship, but we are able to come back to those webinars that we really wanted it to attend, but we couldn't, as you could see here. But this is an established, I guess, link that we have through the World Stroke Organization. We thank, obviously, the WSO for the creation of the World Stroke Academy. So, we have learning objectives, and definitely we have especially four core objectives for our fellows. So number one is to understand neurovascular anatomy and imaging, as Dr. Gordon Perue was mentioning. And the idea is that you can master all the fundamentals on neurovascular structures and also understand imaging technique, right? So you can provide an accurate diagnosis and treatment of the diseases you're going to be, dealing with in your fellowship. We want to make sure that our fellows develop proficiency in endovascular procedures, so you can actually have hands-on experience on how to perform aneurysm coiling, spinal interventions, and mechanical thrombectomy. We also want to make sure that you become a well-rounded, proficient clinical decision-making person, right? And not only that you can do diagnostic procedures, but also that you can understand that complications may arise from those, as well as therapeutic procedures, of course. And then you have the skills, right, and the knowledge to actually take care of them or handle them. We want to make sure that our fellows understand emerging technology as we stand, right? Like we know that AI for the last few years, at least in the United States, has been part of our day-to-day practice, right? But so is true for robotics, right? So we want to make sure that our fellows have the opportunity to be in the forefront of innovation in neurovascular care. The structure of the program, as we mentioned before, will be through didactics, right? And those didactics will be mostly live through a Zoom platform. And the idea is to cover all the important topics that you need to become a, well-rounded interventional, neurologist or neurosurgeon or radiologist. And we want to make sure that our fellows have an in-depth understanding of these essential concepts and techniques. We want to open the opportunity to the fellows to be able to discuss cases too through their faculty. We want to make sure that the faculty who provides, those topics are obviously experts and leads in the field. We want to make sure we also create an interdisciplinary, multidisciplinary collaboration among different specialties within our field. We want to make sure that you have the opportunity to watch them at a different time, right? In case, God forbid, an emergency may come, you still have the chance to go back to that lecture and be able to actually, learn from it. And we, like I mentioned before, we're going to do this through the World Stroke Academy. And the idea is that our fellows not only are able to access that, but also grow academically, right? Through science. There are different topics that will be covered through the whole year of lectures, right? That you will have. But I just want to touch base because this is actually a task that I was given by Dr. Goyal to make sure we understand all the topics that will be covered through the year, and want to make sure that's clear for everybody. Of course, as science emerge and there's more topics or subjects to be included, obviously that's obviously to be included on our curriculum as well. And month one, the way it was designed is that we're going to have basic concepts in anatomy and imaging, so you can actually read, and perform your own diagnostic cerebral angiographies. On month two, we're going to talk about mechanical thrombectomy for acute ischemic strokes and different indications and techniques to perform this procedure. Month three is being designed for endovascular treatment of aneurysms. And, that will be anywhere from, flow diversion devices, coiling, stent-assisted coiling, among others. We also have, obviously, a whole month dedicated to AV malformations, where you can explore the endovascular treatment strategies of AVMs. As you can see, different months will have different topics, but obviously we have to touch base on imaging as well, and imaging of complex cases through 3D angiography, perfusion studies, and Dyna-CT. Also to be covered is managing procedural complications that, even though, that's not something we would like to see, sometimes you as an interventionalist encounter those, unfortunately, commonly. So you don't always, it's not only to identify them, but to know how to prevent them and manage them. So that's going to be something you're going to be very skilled at the end of the fellowship to actually take care of. And obviously complications such as hemorrhage, vessel dissection, and embolic events. There's also designation of material for carotid and vertebral disease, and how to treat those conditions endovascularly. Same is true for hemorrhagic stroke. So we're going to learn how to approach intracerebral hemorrhages with the different techniques from the neurointerventional standpoint. You're going to have exposure to pediatric neurointerventions and strategies to actually treat such patients, including Moya Moya and AVMs, as we mentioned before. The opportunity to perform spinal interventions, right? Spinal angiographies and the management and treatment of AV fistulas, tumors, and others. Definitely everything in neurointervention these days is about technology, right? Introduction to technologies such as robotics, artificial intelligence, and novel devices for interventional neurology. And again, you will have the opportunity to do case-based learning, right? Morbidity and mortality, that's going to help you to improve your decision-making skills and obviously to become an independent practitioner. There are other topics that are to be included. Typically, these will be saved for you to watch and learn at your own time. But different topics will be covered, including MMA embolization for subdural hematomas, venous stenting for intracranial hypertension, medical and surgical management for intracranial atherosclerosis, as well as challenging mechanical thrombectomy cases. So I just want to mention this because this is important work that has been actually put in and conceived already by our team. And, other things that we would like to include are preoperatively tumor embolization and intraarterial chemotherapies, management and recognition and diagnosis of AV fistulas, and neurotrauma, of course. And the educational material will come in different shapes and forms, textbooks, manuals. You're going to have access to PubMed, so you can look up the most up-to-date literature, also to enhance your research abilities. Definitely webinars, right? We talked about this, and all the material will be found through the WSA, the World Stroke Academy. We're going to, enroll in courses. This is actually very unique, and perhaps Dr. Inoa, will give us more information as we move along on this, but also how to perform certain procedures step by step. So you can actually watch those videos and learn how to do certain procedures, and also have the peer mentorship through this fellowship. With that, I'm going to just probably close the session and open it to questions and some answers. But I just want to tell you that we are delighted to be here. This was conceived a couple of years ago, and I can't believe it's all already a reality. So we look forward to work with you. We're committed to increase capacity in low to middle income countries, and no matter where that country is, and if you are that person that wants to do neurointervention, I think this is the fellowship for you. So I really appreciate the time, and I would just open the session for questions and answers at this point. Thank you so much.
Thank you so much, Rina. Thank you. I've been looking at some of the questions on the chat. If you have any questions, just please type on the Q&A. And I'm going to show something that I hope answers some of these questions. So we've been looking at questions about who can apply and if that person is a good fit and match for the fellowship. So in terms of the candidates, we can go over some of these criteria. Again, Dr. Gordon Perue was able to tackle these, but I'm going to repeat them. So doctors that are living and working in low to middle income countries right now, that have completed prior training in neurology, neurosurgery, neuroradiology, or have interventional radiology training. They have a valid medical license in their country, and they have validated their title or in the process, or will be able to validate the title where they're going to be training. Obviously, all of the paperwork that is needed, migratory paperwork from one country to the other will be hopefully facilitated, but that's going to be at the expense of the trainee. And these people should be committed to come back to their home countries. People were talking about sponsorship. As I said, sponsorship can come in multiple forms, but in terms of the amount, what we are looking at is for fellows to have the same level of a sponsorship that people have in their harbor countries. So if you are going to Canada, we need to figure out how much a fellow gets paid in Canada, and then that's the level of a sponsorship that you will need in order to live in Canada and spend there 1-2 years. So that's what we're looking at. So if you're able to match through your government, through your hospital, through self-sponsorship partners, if we're able to match that, we will be able to send you over to another country. Now, obviously, as we go, we develop, and we will take a look at every individual application. Another question was about the language and the location. So no, this is not a fellowship for Latin America. This is an international fellowship where everyone can apply from Africa, from Egypt, from Latam, anywhere. What we are trying to do is to match you with an institution that speaks your language. So, for example, if you speak English as a primary language, but you're proficient in French, you could go to France and train. So as long as you're able to communicate with the patients and have enough fluency where you could learn in another language, you could go to a language, excuse me, to a country where you can. This is live. Okay, well.
So as Dr. Inoa says, it's really about trying to make sure that you are matched to a place where you can comfortably train, where you know the language and you're not having that barrier to your learning. Really, that's all it's about. So if you're fluent in French and you speak and read and write and you're comfortable, then yes, you could go to a place in France for training. And as Dr. Inoa said, it is not just one country. It is truly an international fellowship. So we're trying to get you to go really wherever you have the best match. So we do have partners in the Mesa region, in Egypt and in Africa. Somebody was asking that can help us identify a good facility in which you can train. Go ahead, Doctor.
So sorry about that. So in terms of the connection, so the application should be made through the WSO website. So you do not have to contact the institutions directly. This is the beauty of the fellowship. And then who's going to sponsor? So I said the WSO, we are looking into grants. And as long as we have 2 grants for this upcoming year, so that is limited, and we do not know how many grants we'll have for the following year, for example. So as you know, as many grants we have, as many people we can train. So that's why we're trying to facilitate people to get individual grants, you know, from their countries or from their home institutions. So that's how it will get sponsored. Any other questions?
Yeah, there
Any
was a
other
question
comments?
about being an internal medicine doctor and being able to apply for this fellowship, but I think you answered that question already, Dr. Inoa, but maybe it will be good to understand that the background to apply for this fellowship is to be, you know, neurologist, neurosurgery or radiology background.
Correct. And yes, someone is asking if the fellowship, the training should be continuous, and the answer is yes. The fellowship training should be continuous.
We are working with the Southeast Asian sites to try to identify facilities. That's a question in the chat for that part of the world. So more to come on that. There is some WSO leadership, Dr. Pandian, who has contacts on that side. And so I don't have the name of a specific facility for you at the moment, but yes, we are making sure that it's not just one part of the world, but really across the world. Can you do 2 years in 2 different centers? If the centers
Yes.
have partnered with each other, yes.
Yeah, correct. And that's part of why some people will train for only 1 year because they have already been training in another center. The hope is that even if you can train locally, you can get to a high-income country, see the facilities, have a lot of exposure to procedures, but also to mechanical thrombectomy. And as we are WSO and we are highly invested in advancing the treatments for large vessel occlusion stroke, we would like the people that are trained to come back to their countries and to develop programs across the globe.
Exactly. There was a question about will there be an interview, a training center interview, or just based on the application? Yes, we do plan to look at the actual centers, so not just on paper. The details of how we will do that will vary, depends on which part of the world the country is in and who is our advisory board member that's close by, for example. So yes, the trainees will have a mini interview process, as well as the facilities will have an interview process for us to select them as an appropriate site. I'm just double checking all the questions in the chat.
Someone is asking about a list of the training centers. We do not know, we do not have that. We have few centers right now because we started the process in selecting people for a pilot and centers for a pilot, etc. So the centers are going to be in Spain and Canada as of now. We have people interested also in other countries. However, none of these facilities will be formal unless we have a formal application process and we review the facilities. So, and we should not be concerned about the capacity of these facilities because there is certain criteria. As the applicants have criteria, the facilities will also have the criteria in terms of the number of procedures, in terms of the facility itself, and also in terms of the overview. I can show some of that. Let me see if I have it right here. So let me show this again.
While she does that, there's a question about who will issue the certificate. It actually will come from the World Stroke Organization. And the plan is for the certificate to be issued to the fellow upon return to your home country. Again, the emphasis is capacity building in your home country. So once you've returned home and started to work, then yes, you'll get a WSO certificate of international fellowship training.
And there's something important that was on one of the slides, but probably we did not emphasize, which is that we have partnered with the European Board of Neurointervention for endorsement. So our fellowship meet criteria, and we would be able to send fellows to the EBNI courses and to the ESMINT courses. We're still negotiating and looking into the details and the expenses. The hope is that we can get our fellows. We can facilitate our fellows to be part of their courses as well. They will be able to take the test at the end of the fellowship. So if they pass the test and go through the courses, they'll get the EBNI certificate as well. Going back to the facility, so we have certain numbers for the facility, and case volumes should be up there. They should have at least one neuroendovascular suite dedicated for, of course, neurointervention, NICUs, neurocritical care, hospital-based. I believe I had a very detailed checklist for the facilities, and this is not it. So my apologies, but I guess what I want to show is that, here it is. That becoming a facility is also part of an application process, and we want to ensure that the facilities are adequate to train the fellows.
I also want to perhaps answer a question in the chat about being a World Stroke Organization member. So the answer is yes, you have to be a World Stroke Organization member to be able to apply for the fellowship. The World Stroke Academy, though, it's part of the benefits of being, a fellow and a WSO member.
Okay. So again, we should be able to offer a certain number of cases to the fellow. and also a certain number of cases that are performed at that facility. And all of that should be demonstrated on the application form. I am still sharing, I hope. So all of the facilities will have a checklist. They should name a program director, coordinator, adequate faculty members, angio suites, etc. So again, it's a process and everything will be available on the website. I know it's 8 o'clock and I'm seeing a lot of questions. Maybe we have time for another question before we close the webinar. Okay. So again, I think many of the questions are referring back to the paperwork and to facility requirements and location. So everything is going to be posted on the website. And what we're going to do is that within the next week or so, we'll review everything again and we'll open up the platform. There's going to be a very comprehensive list of the things that you need and the details from the facilities. We won't know who's applying in terms of the candidates or facilities until we open the platform. And the plan would be to match. Again, I want to close this webinar because we are 2 minutes past the hour, but I really want to thank, first of all, each one of you for your interest, because without you, this is not going to be possible. Thanks to the facilities, because they will harbor people. They have opened doors to harbor people from all over. Thank to anyone that has worked for this webinar to happen, Octavio, Laura, the WSA platform for harboring this webinar, but also because they will harbor our educational materials. Thanks to Dr. Shayla Martins once more. Thank you, WSO, the World Stroke Organization, who has entrusted us with this idea and has supported evidently this idea. So this happens today. To the WSO president, Dr. Pandian, thank you for your continued support. And I will open up again the platform to my friends in case they want to say a few words, but I am beyond honored to be here with you and to be able to help through this process. I believe some of our contact information will be on the WSO website. So please send those emails. We continue to get some questions, but we don't have enough time. So it seems like people are highly interested. Thank you again, Gillian, Rina, Laura.
Thank you so much for the opportunity to all of you, and we look forward to see your applications. Thank you so much.
Thank you so much. We will look forward to working with you.
Perfect. So from my side, thank you for your warm participation, all the questions we received. As mentioned, the recorded version of this webinar will be shared with all of you on the World Stroke Academy site, so via email shortly after the live event. In the meanwhile, make sure to follow us on X, LinkedIn for upcoming educational activities. And we really hope to see you in our next one, which is taking place on March the 4th, 3 to 4 p.m. CET. We're going to be talking about enhancing stroke care for women, addressing global gaps and needs. Thank you all very much and have a wonderful rest of the day.